welcome to Smart Education Today. Today we are at Jamia Millia University and we have Dr. Tabrez Uz Zaman sir. Hello sir, can you tell us about yourself?
I am Dr. Tabrez Uz Zaman and I am an assistant professor here in the Department of Hospital Management and Hospice Studies. We are a department that was established around 3.5 years back, and I have around 15 plus experience in the field of teaching and research, and we are here to build the department and also to contribute to the society. That's it. Thank you so much.
So sir, what inspired you to join the field of hospital management and hospice studies?
See, the first aspect that comes into anybody from the healthcare background is to work for the upliftment of the patients and also to make sure that the healthcare is affordable and accessible to all the people in the country. So that is, you will find that the need of every government, and this is one of the basic aspects of the health policy. Now there are different stakeholders for this health policy who will try to take things forward, and education is a way of bringing this forward to the students who will be future leaders of our country. So one of the things that inspired me was to give my contribution to this noble cause, and also in order to make people aware of what are the problems that exist in the healthcare field in today's generation. So that is one of the key inspiring factors for me.
So sir, how do you tailor your teaching to address both administrative efficiency and compassionate care?
I would like to divide this into 2 points. The first part is that the teaching now is quite different from the teaching that used to exist before. And now it is a kind of industry-academia partnership. You cannot teach something which doesn't exist in the industry, or the market doesn't need that. So you have to study those things that are existing in the market, and also make your students equipped with more skills so that they can get the best jobs in the market. And the second part of your question is compassionate. Compassionate is when we make our students and even us beneficial to the community. So in these areas we try to attend some kind of seminars, conferences, workshops, even go for community aid camps, and also try to arrange some kind of get-togethers at different levels in the community, so that what we teach and what we preach, there is a relation between both of them. Yes.
So sir, what innovative teaching methods or tools do you use in the classroom while teaching?
This is what we call pedagogy. So pedagogy is one of the very important parts in teaching. So we believe in blended learning. So blended learning means that we try to give classroom coaching, which is the requirement as per the UGC, and also we try to make students learn by themselves through self-study. We try to give them some case studies, we try to give them some group discussions, try to arrange for debates, try to arrange for events when they can present themselves. So this is how we try to give them a holistic improvement. I agree that there are so many other factors that also need to be improved, but at our level, at our university level, we try to make the best of the pedagogical techniques that we have, and also try to keep the students aware of what is actually going on around. And also finally, what I believe is that government also has launched a lot of skill based courses. So these courses also help us in improving or boosting our courses, so that every student who is coming out after doing his MBA Healthcare Hospital Management, MBA Pharmaceutical Management, has got some set of skills with which he can work better in the market.
So sir, being the faculty at this course. Sir, what challenges do you face while teaching the students about end-of-life care, and how do you overcome them?
Okay, this is a very important question. Every population, every generation, there is a initiation and there is a decline. So at the end of care, our students, from our point of view, from the curriculum point of view, we try to make them as far as equipped in terms of the healthcare knowledge, healthcare quality, and healthcare requirements in terms of providing the needs, healthcare needs to the population. Now, whenever you let's take a patient. Now, our student is not training himself as a clinician or a doctor, but we are making him equipped with such skills so that he can run a hospital or a healthcare organization. Now, these kind of skills will help him to manage the whole healthcare process, and when he learns to manage this process, he can also guide the other healthcare professionals who are there in that particular organization. And if there is good quality, good knowledge, and good skills and training and development, these things will ultimately help in better patient outcomes and in treating the end of care treatment for the people.
So, sir, how do you balance theory with practical applications in your coursework?
Okay, so this is one of the key factors that actually decides what you are teaching and what actually the students are learning from what you are teaching. Now, for us, for example, in hospital management, our students do two internships. One is called the summer internship and one is called the dissertation. In these internships, we place the students in healthcare organizations, in hospitals, in NGOs, and also in pharmaceutical companies. In these areas, the students learn to adapt their skills, see the hospital functioning or the healthcare organization, how they work, and try to get an actual understanding as to how the industry works. So this makes them to smoothen their skills. When he goes for a summer training, it's 6 to 8 weeks. So when he comes back from summer training and he joins in the second year, he is equipped with more skills as to how the health care industry works. So this is helping him to understand better in the other in the third and the fourth sem. And finally, when he goes for dissertation, it is a complete understanding of the field, and these two internships really help them to make a practical balance between what they have learned and what is going on in the market or in the healthcare industry.
So, sir, one more last question. Sir, since you have been teaching in the industry for so long, so what is your Guru Mantra or your message to the students who are watching this?
Yes, I believe now it is the century and it is the age of smart work. Previously, when we were small and when our fathers were working, we had the term which is called hard work. But now it's all about smart work. We need to be first hardworking. There is no going back from that statement. But you need to be smart enough to use the latest technologies and use your brains to solve or lessen the time of the work, so that you can get more time in other work and you can develop yourself. So AI is one of the ways that you can develop yourself. And the next part is that you need to be updated with the recent surroundings. You cannot just stay in your class, in your library and think about. You need to be aware what is going on healthcare, what are the new devices, what is the new treatment, what are the government schemes. So this is where the mantra is that to be updated and to be tech savvy. These are the two things. If all the students are good in this, you will find that down the line AI is going to help our students to really come up better. So this is my advice to them, so that like both of the things, they are taking it together along with the study.
Okay. Thank you, sir. Thank you for sharing your valuable time with us. Thank you, viewers. This was Dr. Tabrez.
Thank you.
Thank you.